So I'm Justin. I'm the co-founder and CEO of Gense Technologies. And what we do is really quite simple. We have a portable medical imaging device that does two things. We do preventive screening, so early detection of diseases. The second thing we do chronic disease management. So when things do deteriorate, we can pick it up early so that we don't leave it till too late. So I'll start with a brief visualization of our product first. So in here we have two things, mainly. We have the main device, and then we have the sensor of sorts. So inside these boxes, we have the device. So that connects to two things. It's such a simulation, and that's such a data acquisition as well. It connects to, the first thing, to internet. So we compute indexes in real time. It goes to your app, and then we can control the test. We can control how you take the data, and at the end of it, we can see the results almost in real time. So it takes around a minute of it. So after that, we can follow up, obviously, with the results and with different follow-ups of articles and advices on how you could do things. So other than connecting to the internet, it connects to the second thing. It connects to a belt that we generally wear. And we do a cross-sectional imaging in this. So in here, we normally have to lift up the shirt a bit so that it touches the skin. But we generally do three areas. We do lung, liver, and kidney. So in lungs, we wear it around, just around this area, right underneath your lower chest. And then we do a 5-minute breathing paradigm. We look at lung function. We look at deep guided breathing. We look at spirometric paradigm as well. And then we can look at different lung function-based diseases, so COPD, ILD, long COVID. And then there's also research we're going on in lung cancer and other things as well. So that's lungs. Second part we do liver. So it's quite simple. We do fatty liver in here. A bit lower, we do chronic kidney diseases. So it takes around a minute as well. It's quite simple, and then we see the result in real time. So that's generally what we do. Other than those three organs, we're also having quite a lot of different research in heart, in breast cancer, and quite a lot of different places. So generally, within the space, preventive screening and chronic disease management, we can do this quite remotely in a general level at home, or in elderly centers, community centers as well. So anything pre-hospital. This is actually outdated, and we have 25 people in the team right now, so it's still relatively small. With those, we have 9 PhDs. We do everything in Hong Kong, essentially. So we do the hardware, the electronic side, to the algorithm side, clinical side. Obviously, with the software and other things as well, it's all in Hong Kong. So I think the team itself is quite well-rounded in this. We own all the IPs on all the things that we do as well. So other than this, we've also have a bit of accolades recently. So Forbes 100 to Watch, we've recently got it with Pharmic as well, I think. Last week, we also winner of the Jump Starter competition from Alibaba and QuiView as well. So basically, that's roughly the team of how we develop the technology. And on top of this, we also consider reputation really importantly, because in medical world, we do need quite a lot of well-published papers to do this. So we have 8 professor partners just in Hong Kong. Globally, we have a bit more. So in here, we basically partner with medical schools and engineering schools on our papers we publish. So that includes hepatology, nephrology, and then all of the rest. And like we said, all the deals that we have with the university, we own all the IPs in this. So that's part of it. So other than in Hong Kong, we also have trials going on in Netherlands, in the UK, and in the US as well. So we were running a multi-center trial just to make sure it's working really well in different populations. The early results are already really quite good, which I'll get to a bit later in terms of the sensitivity and specificity of what we do. So other than this, reference cases. So we've been used by the Hong Kong public sector. So Queen Mary Hospital has been using our stuff in the lung, liver, kidney places. And then the Hong Kong government has also been using our stuff for COVID recovery monitoring. So especially early on in COVID settings, before the 5th wave in Hong Kong, generally people after they get discharged, we have to be quarantined in our place for like 2 weeks. So what we did was that we sent the device to them. They can monitor themselves for 5 minutes per day, and then we see the left lung, right lung, and general different places recovering over time. So if there are anomalies, if there are problems, we can spot it early, and then we can look at things a lot earlier as well. Because with the advantage of imaging is that we can look at specific areas, so that it's not the general lung to lungs in aggregates that we see. We see specific areas that deteriorate or improve in a very, very longitudinal setting, so quite frequently. So other than this, other than Hong Kong, global partnership-wise, we have 20 markets that inbound approaching us, including the usual suspects in China and US and Europe as well. So I'll talk about how we generally operate. So we work on a B2B2C model. So instead of asking people to buy the device, put it at home and test it on themselves, COVID is a special case because we have to quarantine. But generally, we do have encourage carers or other people to help them put this on just to make sure it's right. So one thing that we do is in elderly homes, we basically put it inside, encourage a lot earlier screening so that we can do monthly, we can do quarterly screening, and then detect things a lot earlier. And this is something that is really easy to operate. So that's one side. We also do home visits as well. So you can order a test. If you don't want to go to clinic, you go off work, and then you can just ask someone to come up, do the test for you for 30 minutes. And it's generally done that way as well. Obviously, there are other things in public healthcare where we can do pre-hospital screening so that not everything is done in-house as well. But generally, this is what we do in here on the app side. On the top left, it is the user interface, where in the user side, you can see how we guide you through all the sort of a briefing test or other things. We tell you how to put on the things as well for the carers, and generally you can see the results in real time as well. So in the middle side, you can see the lung imaging. So this is something that with the video, we can see in real time. So it's actually something that we take 100 images per second. So on the right-hand side, we see the service provider apps. So this is how you do patient management, how you do booking, and all the rest of it as well. So one thing we do, and we treat it very seriously, is how we do build trust. And the reason why the indicators that we have are actually useful for early screening, for chronic disease management, is because we benchmark all of this with clinical standards. So for example, when we do lungs, we benchmark this with spirometry. So it's basically the gold standard for COPD or quite a lot of lung function-based diseases that are really quite prevalent in the world. So what we do is that when we did a clinical trial, we wear the belt and ask the patient to breathe in into the lung function test at the same time. And in terms of sensitivity and specificity, we have a normal versus disease range, 99% and 98% respectively for this. So as a screening tool, anything above 70 is really quite good. So for 99, 98, it's really quite a lot for screening devices. That's why it's quite useful. So the second thing we do with liver, we benchmark this against ultrasound. So transient elastography, fibroscan. And it's around 90% accuracy in terms of sensitivity and specificity as well. And we also do a bit of MRI benchmarking with PDFF, the fat content. Kidney, it's similar, 90%. We have blood tests, we have urine test for benchmarking and estimating EGFR as well. And that's why this report that we have is generally quite actionable, where in the sense that we can have someone who is non-medical to operate this, but at the same time, the result that we generate, the result we estimate, can actually be read by a medical professional and see exactly what we're inferring to. So going back to the philosophy of what we're looking at, it's really about accessible healthcare. So for this to work, for early screening, for chronic disease management to work, we need several things. The first one is that it has to be affordable. If it's not affordable, we won't be able to do it frequently. So most of the time you do screening, if you go to a public hospital, 18 months, 12 months waiting, it's quite normal. But most of the time, if you wait for that long, even if you don't have disease, you might develop at that time already. And for private sector, for quite a lot of scans, we're talking about thousands, if not tens of thousands of dollars per scan. So affordability is really important. And what we do is that for a couple hundred Hong Kong, we can actually send someone to your place to do the test for you as well. So this is something that we can do monthly, we can do quarterly. So that's one big part that we really focus on, the affordability of it. The second part is quite obvious, it has to be portable. So one thing that we look at, whether it's for public healthcare, for private healthcare, it has to be pre-hospital as well. So we're trying to alleviate some of the burdens public hospital or general care has. So that's why we have some modalities that can be brought to your home, brought to elderly homes, put in community centers for this. That's quite obvious. The third one is that it's almost as important as the first two is we don't actually need medical personnel to operate this. Generally, we train a carer for like 5-10 minutes. They can already administer the entire scan, because it's not like ultrasound where you have to know how do you put on different angles, how you put on the right amount of gel of it. Or like needles with blood tests where you have to draw blood. It's really just as simple as putting on a belt. And that's how we make it a lot more friendly in terms of user, where you have a carer at home or carer in the elderly centers. So generally, that's sort of what we do. I'll quickly go through the rest of it, where we go through the clinical trials as well. So these are all of the things that we do. The images that you see, we do quite a lot of high-frequency imaging. We're talking about 100 frames per second. That's how we do lung function test. So one benefit of this that we've mentioned earlier is that we can do really, really localized imaging. So for example, when we look at lung imaging, when you have a disease, normally it detects part of the lung first instead of an entire lung uniformly. So for example, if you have 10% of your lung losing half of the function, overall, if you breathe out in a spirometry device, you see 5% differences, which is easily viewed as a noise. But what we do is that we can look at specific areas inside your lungs. And with that, the 50% drop is actually very noticeable in here. So similarly, we do liver and a kidney on this as well. If you do want to follow up, we can talk about how we compare with the different imaging scans, how the device works in terms of how we use electricity, sort of different properties to look at the different functions with different frequencies. We detect fatty liver and normal liver tissues, all of those things. And generally, I can leave it here, and we'll be happy to connect further after the talk as well. Thank you very much.